I'm Dr. Andrea Trenholm. I was a postdoc fellow at St. Thomas University with the Center for Interdisciplinary Research and Narrative, working with Clive Baldwin when I worked as the research lead on this project, Civic Engagement for Health Among Older Adults, which was about creating a strategy for aging in place. And then from that project, we developed a blueprint for other communities and organizations looking to do similar community engaged work with older adults. While the research arm of the project was conducted by my team at St. Thomas University, it was really conceived by our partners at Passamaquoddy Lodge, which is a nursing home in St. Andrews, and Silvermark, a consulting agency for the aging care sector. So with me today is Carolyn Davies, and she's here on behalf of Passamaquoddy Lodge. And I can only describe Carolyn as the heart and soul behind this whole project. She's really a force to be reckoned with, and she's the main reason that the project was successful, really that it took off the ground at all, and why we're here with you today. So I'll just let Carolyn introduce herself.
Well, thank you for that, Andrea, and I'm not sure I can live up to that those accolades. Although I was and am very passionate about what we did in terms of this project, and it's evolving. We continue to reach out to the community and to get new people in the community engaged in having a say in their life. I was the co-lead of this project. I won't tell anybody that it was at 11:59 at night on the last day of the project that they submitted that I pushed send, only to have it say, "You've got too many too many words." And I went, "Oh God." But it worked. We got the funding, and we've had a tremendous time implementing the project. At the time, I was the president of the board of directors for Passamaquoddy Lodge, and that's not. I'm no longer, because they have a 4-year best before date, and I hit my 4 years, so I'm no longer the president. I also chair the St. Andrews Age Friendly Advisory Committee, and there was a connection because the Age Friendly Advisory Committee informed the initial outreach that Passamaquoddy Lodge was trying to get into the community to find out what would help keep people in their homes. And this was in 2017, before we had the Nursing Home Without Walls, before we had a lot of these other initiatives. So the board was very active right from the get-go. And really, our drive is to support aging in place. We want people to be able to stay in their communities, and we'll explain to you today how we've reached that.
Okay, thanks, Carolyn. Sorry, I'm just having there we go. Okay, so our agenda for today is really shaped by our 3 research questions from our project, which are also described in the abstract that was circulated for this. And in addition to these 3 areas, there's also, we'll give a little bit more about the context, which Carolyn kind of got us started on a little bit already. And then we'll also close out with, just to round out the story of what's happening in St. Andrews now. But within, we'll look at how does a community bring to realization an aging in place strategy? What are the best processes to engage older adults in community development? I know using the term best or best practices, we use it all the time, whether it's actually best or it's a combination of what we did, but also what we learned along the way, and that could have been better. And what are the benefits of civic engagement for older adults themselves? So that's what we're going to dive into today. Okay, so a bit of background context. As most of you on this call probably already know, the Public Health Agency of Canada chose New Brunswick to be the site for the Healthy Seniors pilot projects, which was this big $75 million agreement, which was huge news for New Brunswick, and was, of course, jointly led by the Departments of Health and Social Development. Our specific project, this one, I was actually involved on 2 projects, but this one was funded in the 3rd round of funding. And we began in April of 2022 and finished in July of 2023. So it's been just a little while since we did this work, but we're happy to be here with you today. And I should note that, so as we all, probably most people on this call already know, that in New Brunswick, our province was chosen for this HSPP project because 23% of the population is over 65 versus 19% of the rest of Canada. second only to Newfoundland. And that was the 2021 stat, so it could have changed a little bit, and I imagine it's a bit higher than that by now in 2025. St. Andrews, where we conducted this work, in 2021, the stat was 34% is over 65. So it was a really unique community to do this in. And part of the reason for that stat, we believe, is that it's a really nice place for people to retire to. So we kind of coined this term retiree drift. But I will say that there's also a lot of people that are from there that just love it there and they stay. So yeah, so I'm going to dive in. Carolyn, did you want to give just a little bit of background on Passamaquoddy Lodge and where they were at when we started, and also the vision for the future?
So I can't see the slideshow, so I'm assuming you can see the picture of the building as it is now. It's a
Okay.
building that was built in the doors opened in 1973, and when the doors opened, the people who were staying there had different needs than the people of today. A lot of them still drove, so they basically were looking for a place where they didn't have to make their own meals and look after a large house, but they could stay in their community. Nowadays, the people coming into the nursing homes in this province have a lot more different needs, are usually older and are at a point where they cannot do a lot of things for themselves. And so the facility does not accommodate in a room, if somebody needs a wheelchair and a walker and a lift, they have to be taken out into the hallway to be lifted out of the wheelchair, to be then carried in by the lift into to put to a bed. So we have different needs now, and we need a different facility. And this was also informed very much by COVID. So what we have worked on is this concept, which would include the daycare in the lower left-hand corner. The daycare in St. Andrews has grown by leaps and bounds. It currently has space for 58 students, and they have they're licensed for 118. So the demand's there. They just need a building that is purpose-built, and we all know that intergenerational activities enhance the lives of the youth, it enhances the lives of the seniors, and enhance the lives of all the ages in between. We also would incorporate a community hub in the top right-hand corner, which would house programs and services to support aging in place. And our concept also has 5 12-bedroom homes for the nursing home care. This is a response to the needs that have been researched around the world, that people like to live in a home-like environment, not in an institutional environment. It speaks to what we learned from COVID, where a number of people in nursing homes around the world died of loneliness, not of COVID, because they were isolated. So we're trying to make sure that people are not isolated, that if you have a virus in one house, the other households are open. So that is our concept. And we sought to inform it by this HSPP project.
Okay, thanks, Carolyn. So yeah, as Carolyn was mentioning, this is a plan for a whole new nursing home to redevelop on a new location, the Passamaquoddy Lodge, and shift the old institutional building into something else for the community. For our project specifically, we were interested in looking into this space that they talked about, Carolyn mentioned, as a community partner space, or we could just call it a community hub. I'm just going to advance forward. And so similar to another HSPP project that many of you have probably heard of, Nursing Home Without Walls, Passamaquoddy Lodge was also looking at how do you extend services to community members, and how do you bring community members also in to the facility to engage with residents. So they were really looking to see how do you develop programs and activities for community partner space that would support aging in place. And so just to be clear, in case anyone's not familiar with this term, aging in place simply means having the health and social and community supports needed to live safely and independently in your own home for as long as you wish. And a lot of people might wonder, well, how does having some kind of community partner space in a nursing home support that? Well, they just felt that it could, But rather than decide this is how it's going to and do it from a top-down approach, they took kind of the brave step of opening this up to community to get input from them. What do residents want for themselves? What might be helpful for helping them to continue to live healthy lives while still being at home, but with a sense of connection and support. So we sought out to have engagement sessions to flush this part out, develop a community partner space, but also to research the engagement process. So that's what we're going to kind of walk you through. How do you do this today? As Carolyn mentioned, she was a co-chair on the Age-Friendly Community Advisory Committee because St. Andrews is an age-friendly community. And there's actually quite a lot of members from that committee that also came out to our our engagement sessions. And I would say that St. Andrews was also perhaps more like there was a large number of people that were at least involved in one other thing in their community and coming out, and some were involved in many other things. So it's quite community engaged already. And I'm just showing the age-friendly community domains because it's important to note that civic engagement is involved in all of these domains. In order to kind of flush out what you want for each of these within any given community, citizens should be actively involved in that process. Quick definition for civic engagement is that civic engagement recognizes the contributions that older adults have made to our communities, past tense, what they've already done in their lives, and also those that they're able to continue to make. So it's recognizing that they still bring skills and wisdom with them and are still able to make contributions to community. And believe me, they really did in this project. Okay, our model for community development. This was largely based on the extensive work of the Tamarack Institute. I'm not a community developer. This was really tackled, this part of the design was really tackled by our colleagues at Silvermark. But they really base this on what the Tamarack Institute has already developed. It's rather than reinvent the wheel. So Tamarack Institute really defines community as a verb, not a noun. That it's an interaction and constantly involving people through actions that makes it community. We based the design approach that we used was based on asset-based community development. So what's already there in the community? Are people aware of this? And so forth. And also this foundational principle of nothing for us without us, that older adults should always be involved in any decision making that is being made for them. And we discovered, this isn't really new, but that trust and relationship building is critical. And I'll just give you a little example. Because this project started in 2022, and we're talking about nursing home context, this is right after COVID. And at our initial engagement session, a lot of things started coming out, even though we had good turnout, which I'll get into in just a moment. There was a lot of things that came out where people felt that their trust had been breached and they didn't really trust Passamaquoddy Lodge, just for all kinds of reasons, like not being able to see their loved ones during the COVID pandemic was a huge one. And that happened in nursing homes all throughout the province. And so we had to deal with that as being like the elephant in the room, because you can't move forward if people feel like they're not really trusting where you're at. And by the end, the improvement in the relationship was quite remarkable. Okay. So what did this engagement process look like? The most important thing I want to leave all of you here with today was our decision to use peer researchers. This was actually kind of a secondary decision, to be honest. When we put in the application, it did not involve peer researchers, but by the time that we were informed the application was successful, we had lost several months of our time to do this project. I think it was cut by at least 6 months. So we had to find a way to kind of get in and do it faster. And so this was a shift, and it was a really good one that in the end we said was the most important decision that we ever made, because we recruited a group. I'll just advance slides so you can see this.
Can
We
you
recruited.
acknowledge one of the recruits is sitting in the room?
Oh, yeah.
Gary's there.
Oh, Gary's here. Okay. I wasn't sure because we had this new link at the last minute. Yeah, Dr. Gary Irwin Kenyon from St. Thomas University was recruited as a peer researcher support person. Gary is the one who started the gerontology department at St. Thomas University years ago and had just recently retired. And we were really lucky that he agreed to be part of this project. And then we also recruited, through really Gary and Carolyn, we recruited 7 peer researchers. So that was a relational recruitment of them. And then myself and a research assistant, we went down and trained them over 2 different days, several weeks apart. And so they got kind of a fast version of training in both qualitative and quantitative methods. We really focused mostly on practicing doing the qualitative interviews that were designed. But also they were available to help guide anyone with the quantitative survey. That was predominantly done online, but if somebody didn't feel comfortable doing it online, we had hard copies and peer researchers would support them. We also trained them how to use new technology. Everyone was equipped with a laptop, and which we had, we'd uploaded everything we needed on those laptops and designed them at STU. So everything was right where they needed them on their desktop. They recorded interviews right on the laptops. And then they slid them into the audio recordings into a shared file, which was connected to a Google Drive. It was uploaded there, but we had to also, we don't want to keep things in Google Drive for too long. So they would tell us right away when they finished an interview. And while we were in Fredericton, we could go in, get those files, download them to our secure hard drives, and then they would delete them. And everything worked really, really well. And most importantly, I would say that well, first of all, they were group facilitators, like for tables during our engagement sessions, because we realized with just our project team, we didn't have quite enough. I think the most we ever had was we needed 14 facilitators for one event. So that's quite a big number of people to have. And so having this group of 7 peer researchers was integral. But also, more importantly than that, they were the ones who recruited participants. So people were no longer, like, once they'd come to engagement sessions, they weren't just approached by me or a research assistant to partake in a research interview with an outsider that not from their community, but they were basically being asked to have a conversation with a friend, someone from their community. So even if you're doing a project that's, or if you know anyone that's interested in doing this kind of work, and it's not necessarily research focused, but you just want community ambassadors, this approach would still work really well. Okay, this is kind of our timeline for our project, but I already mentioned it took place from about April, May 2022 until April 2023. That's when we finished our last round of interviews, and then we had a couple more months for final reports to be in. Even though there's just 4 pink dots, we did do 2 community engagement sessions in November. So altogether, there was 5 engagement sessions hosted. More than 80 attendees came out to those or participated in those sessions. And I think we had more than 80 at the very first one, and the numbers kind of dropped off a bit for later ones. There was initially over 1,000 ideas that were kind of being batted around that they had generated at the very first community engagement session, which then we applied a thematic analysis to. I think we first brought them back to participants with about 8, and then they helped narrow them down to 6. And from those 6, then 6 action plans were created. But again, it wasn't just the project team that developed these action plans. We did those through 2 working sessions in November with participants, and they helped to develop these 6 action plans for their community. So this is just the feel-good photo to include of everybody kind of hard at work, and there was very lively discussions that were happening at that first session. Okay, I'm just sharing this. Carolyn's going to speak more to each of these later, but these were the 6 action plans that were developed in St. Andrews. So it's what they felt that they wanted and needed in order to support aging in place, or what could be in this community partner space. In different communities, these could look different. So they came up with adult day program, resource center, a pool, activity center, workout space, and a community kitchen. But again, I'm going to let Carolyn speak to it more later, because I think it will be more interesting for you to hear about where things are now instead of just what was brought up as a plan more than 2 years ago. Okay, research methods. For all of the researchers in the room, I'll try to do this part kind of quickly. As I mentioned, we use both qualitative and quantitative methods, so it was mixed methods. Most exciting, I think, for me was that the peer researchers did the majority of these interviews. So you can see that there was a bit of drop off by the second round, but still pretty good numbers for qualitative research interviews. I also conducted 5 stakeholder interviews and did the focus group with peer researchers at the end. So all of their feedback of their experiences is also in our final report. And then kind of an unofficial method is that we also collected attendee satisfaction surveys following every engagement event so that improvements could be made along the way. One thing I should just note is one of the main things that we found that we learned about for moving forward was as an accessibility factor was hearing. And especially when you're engaging a crowd that's predominantly over 65, hearing becomes a major, major accessibility issue. And trying, we tried so many different venues to find what's just the right thing, but that there's more on that in our community report and the blueprint. So quantitatively, again, this is predominantly an online survey, but we did have hard copies because some people were just not comfortable completing it online, but willing to participate, and they would just mail them back to us. We gave them all prepaid envelopes. You can see there's quite a big drop off from the first to the second round. Honestly, I don't think people like doing this survey that much. These are the standardized scales, right? And it kind of gets a bit lengthy. Again, this was like included in the application, so we had to stick with these ones. That's what we proposed to do. We had a civic engagement scale to measure civic engagement attitudes and behaviors, a personal social capital scale. So what this refers to is people's awareness of resources available in their community. And also, so I'll speak more to that in just a moment when I get to some results. Personal well-being index and the psychological well-being scale. So that's what we used. You could use similar but slightly different ones as well, just something that kind of gives you some pre and post measures. I should say, because those numbers are really small, we did not report on statistical significance. We could only speak to trends. But we did have all of that rich qualitative data to kind of interweave with it, and it was supportive of what we found in the quantitative data. All right, so what did we see in terms of results for participants themselves? We found increased civic engagement attitudes and behaviors, an increased sense of mobilization, and participants wanting to know what's next and how to help. This came from a lot of people that were so involved and engaged by the end that they were like, well, okay, but what's coming next? Like, what more can I do? We want to make these action plans a reality, right? There was also this increased awareness of organizational resources available in St. Andrews. That's speaking to that personal social capital scale and also what we saw with qualitative data. And most importantly, I think, is this second part of it. It's the belief that such resources might be able to help them if and when they need it. Because just because you know a resource exists in your town doesn't mean you believe that they're actually going to be able to help you. So that was really interesting to find. We also found an increased sense of social belonging through community connections that were fostered. And what was very cool, to speak very plainly, was that we found this both from people that were new to St. Andrews and had only been there for like 1 to 4 years, but also amongst people that had been there 20, 30 plus years because they met people in a new way. They had different kinds of conversations with them. So that was, and then that kind of speaks to the last 2 points here, that there was this increased sense of future security and an increased sense of shared future. So what does this mean? It's that a lot of people had worries about what aging is going to look like for them in the next 10 to 15 years in this community. But they originally felt that they were kind of alone in those worries. And instead, what they found through this project is that a lot of people shared those same concerns, and now they felt connected. And because they were all having these conversations and kind of working towards something together, they felt better about it. They felt that there was less to worry about it and that they had this shared future and they felt more secure, which I thought was pretty cool. I do have a few, I'm just being conscious of our time here too. So I'm just going to take a quick sip and let you look at the participant quotes for a minute. I think on this slide, the one that I love the most is the third one that just says seniors helping seniors, because this is a quote about our research, this whole project, and it doesn't say anything about a research team or the engagement team or anyone else. It just recognizes seniors helping seniors, like they were in it together and that it was helpful. A couple other quotes here. These ones speak more to the fact that Passamaquoddy Lodge took the time to ask people what they want. They didn't decide for them. And so, as this one in the top right says, she says, I think it's really important and valuable to ask people for ideas always. And this bottom one is that someone has said, I was glad to have the opportunity to give input. You know, they're not always being asked for their opinions and input in these decisions that are being made. And then she also felt that there was an incredible spirit of cooperation that was at these events. Like they were quite energized. And then these are peer researcher quotes. So I just wanted to share a couple of these. One person said, I just love listening to people sharing their ideas, and I couldn't believe they were so passionate about what they would like to see. And another person kind of looks at it from another vantage point. This one says, it was humbling for me to know that I provided a gateway for someone to participate and they might not have in the same way. And I 100% agree with that. And it goes back to at the beginning, I said it was like being invited to have a conversation with a friend instead of like have a research interview with a researcher. And I think that that really made a huge difference. Okay. So the blueprint for communities, that's right in our title for this session. So I'll just point out, we did develop a blueprint for communities. This is only available in English, so I do apologize to everyone looking for a French one. We did not have it within our HSPP budget to get this fully translated at the time, but it is accessible, so you can grab it through this QR code. I have another one at the end also. I just want to walk through a couple of key things. So this is what the table of contents is. It's right out of that document. Unfortunately, again, we don't have it in the French version. And I really want to hone in. So it gives a lot of the background information that, again, you can also find from the Tamarack Institute about what is civic engagement, why is it important, that kind of thing. But the why are you engaging and how to map your plan, that's what I want to just lean on for a second. Again, these levels of engagement, we did not invent these. These are from Tamarack Institute. This is our schematic, however, but I wanted to share this today because if you're thinking about doing this kind of work, it does take time. And the deeper level of engagement you want to engage with, it can take more time and certainly more planning time, as we learned. And if you really want to get to community-based decision making, that requires this empowerment category. And it's a little bit scary because you are relinquishing some control because you don't really know exactly what everybody's going to say, right? You don't have control over that piece. How to map your plan. So this is kind of, we went back and forth with all of the findings that are in our big research report. I don't think it's as neat and tidy as this. I originally used something like an input process output framework, and it was my colleagues at Silvermark that was like, okay, let's call this planning, promoting, and engaging. And I think it's a perfect way to break it down, is that you really need to think of planning as like setting your goals, your parameters, your design, including those accessibility things that we kept, kind of bumping up against throughout the project, and really taking time to also then promote very clearly. This is your like communication piece. Communicate, communicate, communicate. And we realized, like, as people started to come out, especially that first event, some of them thought, oh, we're coming out, we're going to talk about this vision for the new Passamaquoddy Lodge. And we were like, no, we're talking about the community hub space. So some of it was learning a trial by error, right? We had to get really clear on our communication. And again, we had a bit of a rush time frame. So then people were like, well, we got to get going. We have to have the first events so that we can get in, 4 or 5 before our time is up. So the blueprint is not, we're not putting it forward saying we did everything perfect. These are the best practices, but we're putting it forward saying this is also really what we learned from some of the mistakes that we made also. So that's how you break that down. And I'm going to pass it back to Carolyn to close us up with a discussion about what's happening now.
Well, thanks, Andrea. And just to go back to your point about, expectations in that first meeting, we almost lost probably a large number of the participants, and it was thanks to the work of Andrea and her team and Silvermark and their team that they got the group back on track, and we managed to get some really valuable and insightful input. So Andrea showed you the list of the 6 that resulted in our action plan, 6 items. The first one I'll talk about is the Seniors Resource Center. Anytime you live in a community, I'm sure everybody complains that they don't know where to find out what's happening. And if you don't have the internet, you really are up against it, especially there's a lack of printed material these days. And so what we've done, Passamaquoddy Lodge undertook to set up a Seniors Resource Center. It's funded by the Nursing Home Without Walls program. It provides services to all of Charlotte County, to seniors in all of Charlotte County. So it includes Grand Manan, Campobello, and Deer Island, just to give you some of the geographic difficulties of a rural part of New Brunswick. But we had a soft opening in November 2023, and we are up to over 450 registered clients who are actually getting services from, whether it be extramural, whether it's be a government program, whether it's getting their OAS, whether it's getting their roof repaired. It's just been absolutely amazing, and they're seeing that people are going from, one of the saddest things I heard was they went to visit somebody in the county, and they had, the only food in their house was a bag of frozen vegetables. And there was no Meals on Wheels for the community, there was nothing. And so this program is allowing people to get access to, actually over $800,000 has been given out to these clients in terms of direct attendant transfer, OAS, refunds under the from Revenue Canada. So it's helping people stay in their homes. The town of St. Andrews also undertook 2 of the items in our action plan, the activity space and the workout space. And it's co-located with our youth center, which is fabulous. It will allow us, we haven't got there quite yet just because we're still getting the programs up and running and getting the space. Acoustics are a problem, as Andrea said. As you get older, your hearing is not necessarily as what it should be. And they have a gym in the youth center. It's a small gym. But if somebody's trying to play bridge in the other part and somebody's doing line dancing in the gym, you can't hear yourself bid, you can't hear yourself think. So there've been some, we will get into intergenerational work so that the students who come in will help the seniors maybe learning how to navigate the internet, maybe they'll play games with the kids on, or watch a movie with them. So that is down in the future. There have been over 2,000 people have taken up the activities, whether it's with the activity center, so playing games, reading books, or with in the workout space. And that could be, and Gary can talk to the chair Tai Chi and chair yoga, the line dancing. A friend of mine who says, I hate being out in public, she's now line dancing every week So it's been really tremendous to see the involvement people have in the community. We have 3 items that we haven't been able to implement yet, not because we don't want to, but because they're
They're in the plans.
well, they're in the plans, but they're specific guidelines that regulate, like an adult day program. We have to adhere to the provincial guidelines. There is no facility in the town or village municipality of St. Andrews to accommodate an adult day program. So it has to be purpose-built, and that is part of our community hub. There was tremendous discussion about having a pool, and when Andrea talked about the process, we did, they narrowed it down, in November, they narrowed down over 1,000 items into 6. But we went back to them in February to validate that this is in fact what they were asking us to do. And the discussion about the pool was quite heated. Well, I shouldn't say that. But
we wanted them to drop it, but people were very adamant that they wanted a pool.
So some people wanted a pool to do lakes. So what the Age-Friendly Advisory Committee, we get allocated some funds every year, and we have hired a shuttle bus to take people from the St. Andrews area to St. Stephen, to the Garceland Center there, so they can do their aqua fitness classes, they can do their swim their lakes and whatnot. But what we've included in our proposed new complex is a therapy pool. And we all have gone through phases where we've been injured, or we have a family member who maybe had a hip or knee replaced, or has had some damage where water is much easier on the body to help you recover. So we have included a therapy pool in the community hub. The last but not least is a community kitchen, which is interesting that this keeps coming up, because it was on our list in our action plan from the Age-Friendly initiative we started in 2017. There are a couple of facilities in the community that could become community kitchens. Nobody's put their hand up yet. And despite Andrea saying I'm determined, which I am, I haven't been able to convince anybody to take this on yet. So if it isn't undertaken by somebody else, another group, it'll be incorporated in our community hub. I guess a couple of things. One is that if you're going to go into a project like this, you have to have the right partners. And we were extremely lucky to have Silvermark and St. Thomas, in the form of Andrea and her team, who could pivot on a dime to meet the changing timelines, to meet the needs of the community, to reassure participants that in fact their input was being heard and it was going to be respected. And so if anybody's going down this road, just make sure you have the right partners. So anyway, that's it for me. Thank you.